You've got three main types of Medicare Advantage plans to choose from: Health Maintenance Organization, HMO, Preferred Provider Organization, PPO, and Special Needs Plans, SNPs. HMO plans require you to select a primary care doctor and limit care to network providers, aiming to offer cost-effective healthcare. Each plan caters to different healthcare preferences, ensuring you can find one that fits your situation. Uncovering the nuances will better equip you to make an informed decision. Exploring HMO plans. When exploring Health Maintenance Organization, HMO, plans, it's crucial to understand that you'll need to select a primary care doctor to coordinate all your healthcare services within the plan's network. This requirement is fundamental to how HMOs function, emphasizing the role of primary care in managing your health. By design, these plans are structured to offer you a cost-effective way to access healthcare, primarily because they limit care to providers within their network, thereby reducing out-of-pocket expenses. Understanding PPO plans. Diving into Preferred Provider Organization, PPO, plans, you'll appreciate the flexibility they offer in choosing healthcare providers. Unlike some other types of Medicare Advantage plans, a PPO plan doesn't require you to select a primary care physician or obtain a referral to see specialists. This means you have the liberty to consult specialists as you deem necessary without jumping through additional hoops. One of the greatest advantages of a PPO plan is the extensive provider network. While you're encouraged to use providers within this network for lower out-of-pocket costs, you're not restricted to them. Should you choose to receive care from outside the network, your PPO plan will still offer coverage, albeit at a higher cost. This balance provides a blend of cost savings and flexibility. Special Needs Plans Overview. Special Needs Plans, SNPs, offer a customized approach to Medicare Advantage, catering specifically to individuals with certain chronic conditions or tailored healthcare needs. These plans stand out because they provide tailored benefits and care coordination designed to meet the unique healthcare requirements of their members. If you're navigating the complexities of healthcare due to a chronic condition or specific healthcare needs, SNPs could be an optimal solution. There are three main types of SNPs: chronic condition SNPs, dual-eligible SNPs, and institutional SNPs. Each type focuses on a different group, whether it's those with specific chronic conditions, individuals who are dual-eligible for Medicare and Medicaid, or those residing in institutional settings. To join a special needs plan, you must meet the eligibility criteria, which might include having a qualifying chronic condition or being dually eligible.